Moving on, this is Chapter 4, Patient and Caregiver Teaching. Patient teaching and caregiver teaching really is one of those key nursing interventions that makes a difference in your patient's life. It really can go a long way, not just in helping them treat that current illness, but also helping them to stay healthy, helping to prevent that recurrence. The general goals for patient teaching include health promotion, identifying those unhealthy lifestyle choices, disease prevention, illness management, and selection of use of appropriate treatment options. What works for one patient may not be effective for another one, and really working with the patient, talking to them to identify the best intervention for each one. The role of patient and caregiver teaching, keep in mind that every interaction is a potential teachable moment. It could be that ending discharge teaching, that formal teaching when we're making sure that they're clear with everything, but it can also be informally, just as you're having a discussion with a patient, as you're passing medications, and you identify an area that they're unsure of. That can be an excellent other teachable moment. Writing those teaching plans and providing guidelines for specific learning needs. When we're sending a patient home that needs to do a dressing change, if we taught this patient to administer their own insulin, sure, they've just started their insulin while they're here in the hospital, but have we taught that patient how to do it themselves? Have we verified that they're able to do it? Also, keep in mind that teaching is not something you can delegate to anyone else. There's an acronym for what you can and can't delegate when you get to your ATIs and NCLEX, and we'll be talking delegation much more throughout this course. That acronym is TAPE: Teach, Assess, Plan, and Evaluate. You cannot delegate anything that involves teaching. You cannot delegate anything that involves assessment. You cannot delegate anything that involves planning. And you cannot delegate anything that involves evaluation. That must be done by you or another RN. The RN's responsible for this patient caregiver teaching. Everything from assessing the patient's ability, their readiness to learn, identifying their teaching needs, developing these goals, implementing a plan for this teaching, evaluating the patient's learning. By that we mean verify that they actually understand it. We haven't just walked in, talked to them, and then watched them nod and we walked out. You want to verify they understand it. A great method for that's going to be teach back. And that's going to be that preferred method that comes up a lot. You're first going to demonstrate, teach the patient, then you have the patient demonstrate and teach it back to you. And that really is that one of those ironclad ways of verifying that they understand. There's a difference between learning and teaching. Teaching is the act of conveying information to facilitate learning through instruction, coaching, counseling, or behavior modification. Whereas learning's the act of acquiring that knowledge or skills that may produce a change in behavior. And the patient has a right to choose if that change occurs. You have your role to teach this patient, and it's really to find strategies and methods to encourage that patient to be a willing participant. There's nothing worse than sitting here trying to teach a patient something important while they're watching TV. Can we force that patient to learn it? No. But we really should do everything we can to encourage them to. Again, that teaching may be formal or informal. Help to organize the information and skills to make learning more efficient. Keep in mind that lots of people learn in different ways. Some people are read-write learners. Some people are more hands-on learning. Some patients like to just learn just from talking and explaining. And really trying different methods and different strategies to see which stick, to see which your patient are the most receptive to. As we said, there's many goals for this patient teaching, everything from health promotion, disease prevention, illness management, and the selection and use of the appropriate treatment options. Those patients have a right to make an informed decision of the available treatment options available to them. And this teaching can help prevent complications, promote recovery, self-care, their independence. 6 in 10 adults in the United States have a chronic disease, with 4 of 10 of those having 2 chronic diseases. And there's a lot of education, treatment, and self-care and management that goes into helping them treat themselves. The knowledge gained through this teaching can help the patients manage these health problems, improve the quality of their lives, and even more important, reduce hospital readmissions. A lot more important, just as important. As you're probably figuring out, there is a wide range of nursing models and theories about why we do what we do. And the same is true about education. There's a lot of different models and theories about the effective strategies for education. And these two disciplines really do combine in an interesting way for nursing patient intervention, nursing patient education. Everything from the Knowles adult learning principles, covering how and why adults learn, models to promote health, such as theoretical models of health, behavioral change. My favorite is Orem, since Orem's theory on self-care, motivational interviewing to assist with motivating that patient to change, and other areas covering everything from self-efficacy, patient beliefs that they can succeed. Patient education and teaching as a nurse is a key area of what you will do, and it's also an area that takes practice. You're not going to walk in there day one and be an absolute expert at it. It will take practice, finding your own strategies, finding your own methods, and what works best for you. There's required competencies, knowledge of the subject matter and relatable resources, but also the ability to impart that knowledge to your patient. These take communication skills, verbal, nonverbal skills, active listening, empathy, and you're going to develop confidence as a teacher by becoming more knowledgeable in these topics. The more you learn and become comfortable with it, the more comfortable you're going to be teaching it to your patient as well. Setting aside a time for patient teaching is going to be critical. I know you are going to be busy out there at the bedside. That nursing shortage is across the country, and you only have so much time in that shift with an extremely stacked patient load. But at the same time, you're going to be able to maximize that time by things like setting priorities with the patient, clarifying your time availability with them, and deliver or reinforce that information with each contact. So come in, give your initial patient teaching, and then reinforce that teaching. Bring it back up again with the patient each time you visit, each med pass, each assessment. Identify barriers. Using each patient's going to be able to learn different with different strategies. Identify any barriers that patient has. Do they have a visual deficiency? We're going to stick to more audio and hearing-based teaching. Versus that patient has deficiencies in hearing, sticking with visual representations, visual diagrams. While small print may not be great for our elderly patients, things with larger pictures, and making sure that they understand it. Walk through it step by step with the patient. Identifying their readiness to learn. Is that patient receptive to your teaching? Are they coming in ready to go? Or are they very hesitant? Are they watching TV? Are they not interested? And finding ways we can do to pique their interest, explaining the importance of why they need to learn this. And don't forget to include the patient's family, caregivers, and support system in your teaching as well. About 1 in 4 adults provide caregiving to someone at home with long-term disability or illness. And not only teaching that patient, but making sure that their family members and support staff are knowledgeable about what is expected once they go home as well. Unfortunately, you can have the patient completely recovered, healthy, and taught of what they need to do. But if they are not following through with that treatment when they get home, it's extremely likely that they are only going to deteriorate and come right back. And that is something we really want to prevent. It's all the work we've done in helping this patient recover. We do not want them to relapse. And especially you start talking about chronic long-term illnesses, disabilities, diabetes, hypertension, even things like cleanliness and bed wounds. Everything we need to do to keep this patient healthy at home. And we can greatly improve that strategies by including the family members. Just to be able to give that patient a reminder if they're forgetting their dose. Giving the patient a reminder about best practices if they start to forget something when they go home. We want to include everyone and do everything we can to make sure this patient is taken care of after discharge. There are a lot of regulatory agencies involved in nursing and healthcare. The big one, everybody's favorite, JCAHO, the Joint Commission. A really busy day if you're ever on the floor when the Joint Commission comes. Other ones such as the National Patient Safety Goals, the American Hospital Association's Patient Care Partnership, and the Institute for Health and Care Improvement National Patient Safety Foundation. And these regulatory agencies all state that patients have a fundamental right to receive information about their care. We're not just throwing interventions at patients and sending them out the door. They are active participants in their care, and they need to make informed decisions about their care. And that's going to be where effective patient teaching comes into play. There's going to be a lot of assessments you as the nurse need to do to determine what would be effective with that patient. And there's going to be a lot of factors that could serve as barriers to that patient being able to learn, comprehend, and put into practice your teaching. The first is going to be things like physical factors, age, sensory issues, vision, hearing deficiencies, their dexterity and ability to actually perform the intervention. Also things like pain. Are they in a lot of pain? If that patient's in a lot of pain, they may not be really paying attention and comprehending what you're teaching them. And also things like medication. Do we want to give a patient a sedative or a pain med and then begin our teaching? No, we want to try to pick the right time when that patient is at their most receptive. Other things like psychological factors, anxiety, depression. If this patient's extremely anxious about an impending lab result or a family issue, is this the time for us to be giving them their discharge teaching? No. Other ones such as sociocultural factors, learning factors. Is the patient able to read? Unfortunately, there are a lot of patients out there who have a very limited reading ability. We want to, it's why it's important that we provide this teaching in many different ways. They may be very embarrassed about it. We don't want to put them on the spot with that. But we also want to make sure that we as a nurse are teaching them in a way that they can comprehend. Another area we haven't touched on yet is health literacy. Often we as nurses, those of us working in the healthcare field even, take for granted some of that healthcare knowledge. There's a lot of people out there with very little knowledge or practice or experience with anything healthcare related. And that health literacy just means the capacity to obtain and understand basic health information needed to make appropriate health decisions. For us as nurses, we may take a lot of these common medications for granted and assume the patient knows what it is. Whereas in the other case, this may be the very first time that this patient's ever heard of that. You also see a lot of common health misconceptions on television. My favorite one is a patient's having a seizure and they try to stick something in their mouth. That is, never do that. You're just created a choking hazard and a hazard that could harm the patient. And for some reason that became a urban legend. It gets practiced, you'll see on television and in common media a lot, which probably does a lot more harm than good. Making sure we as nurses have assessed this patient's knowledge. Do they understand what we are teaching them? Try to use basic words. Don't use the large technical terms. The patient doesn't have hypertension, they have high blood pressure. Almost 90% of U.S. adults have a limited health literacy skills, but they'll be very reluctant to admit it. They may be embarrassed by that. Even patients with higher general literacy, they could be very educated. They could have a PhD in literature. That doesn't necessarily mean they have a high degree of education in anything healthcare related. And we need to tailor each of these teachings to match that patient's health literacy. One strategy to make sure we're effectively teaching all of our patients is try and tailor that education for a 5th grade level. That's going to be high enough where we can cover some complex topics, but we also want to make sure we've put that at a level that absolutely everyone can understand. You want to organize that content logically. Highlight the key information. Use common 1 to 2 syllable words. Define medical words in simple language. Use short 10 to 15 word sentences. Include pictures, diagrams, anywhere that we can. Use that active voice in the same manner as you would when you normally speak. Don't read it verbatim off of the paper to them. Speak to them in a normal conversational tone and try to explain that as simply as possible. It's us as nurses, we use the term hypertension all the time. We know exactly what hypertension means. We know what hyperglycemia means. But at the same time, when we use high blood sugar for the patient, they're actually going to know and understand what we're saying. Also keep in mind where the patient prioritizes their healthcare needs. What you think may be the most important may be different from what the patient is prioritizing, what they feel the most deficient in. Also, when does the patient perceive information the best? Some people, morning people, night people, we don't want to walk in first thing in the morning before the guy's had his cup of coffee and try to throw a bunch of patient education at him. We want to find that time when their patient is most receptive. And we really can't stress enough of the importance of assessing where that patient is most deficient in their care. Some patients may be very knowledgeable about one aspect of their care and have a lot of misconceptions and deficiencies in other areas. And that's going to come from assessing our patient, talking to our patient, using that teach back method, have the patient explain to you their healthcare routine, and identifying again those areas of health literacy and any deficiencies. It's finding the best strategies. I cannot stress enough of how each patient will learn differently. Each individual will learn differently. You'll have some students who will just read the textbook and that's all they need to be successful in the class. Other students are basing it on lecture. I keep saying patients. Other students are much better with hands-on learning. And it's going to be to identify which area, which type of learner that both patient is and what type of learner each student is. Planning beforehand is going to go a long way in making sure that you're making both an effective use of your time and you're also effectively imparting this information to your patient. We'll stick to one teaching at a time. We're not just going to come in and throw everything at the patient at once. Say the patient's in with hypertension and they're going to need to be monitoring their blood pressures at home. Come in and teach the patient how to take a blood pressure, but also bring the equipment with you so that they can take a blood pressure themselves and demonstrate. They can also demonstrate that they know how to document that, know how to interpret that data, and they know the dangerous parameters of when they need to be calling in and letting us know when things are trending in the wrong direction. There's a lot of different teaching strategies you can employ, and each strategy is going to have different levels of benefit to patient, depending on the patient's characteristics. Everything from just a basic discussion with the patient. That's going to probably be your most common. Most people are going to learn effectively with a discussion. Other things, demonstration, role play, putting it in writing and letting the patient just read and understand it on their own. For me, I would much prefer to just have a written material of exactly what I need to know, and I can just read that myself. Others are going to work best with discussion. Everything from learning style, age, educational background, their language skills. All of these aspects are going to play a key role in depending on how effectively we've imparted that knowledge. Another area that should definitely not be overlooked is the use of technology in helping patients maintain their health care at home. There are so many different apps out there, so many different tools that those patients can use. It's incredible. I'm sure I'm out of date. I'm still reluctant to get one of those smart computer watches yet. My wife has one, and yeah, just tracking your heart rate, tracking your exercises, tracking these steps walked. And there is an app out there for absolutely about every major chronic illness out there you could think of. Everything from diabetes-based apps, hypertension-based apps, everything from encouraging exercise. And it really shouldn't be overlooked, and it's definitely something to be encouraged. We're at the point where almost everyone out there has a smartphone these days, and there's probably a free app that could benefit them. So we've planned out our education, we've prioritized what this patient needs, we've identified our strategies. Now we're moving on to the actual implementation, actually teaching that patient. Include everything from that verbal and nonverbal communication. Verbal communication is important, but so is making eye contact, looking at the patient. We're not just reading that off a screen. We're listening to the patient. We're listening to their questions. And we're also empathizing. These patients may have a very brand new condition they're very scared of. They're very reluctant to take part in. We want to listen to the patient, have empathy, understand that in the hospital can be a very difficult time for a lot of patients. Consider their physical, psychological, and learner characteristics. Determine how much patient participation can be assumed. Are they able to put this education into practice themselves? Have we included their caregivers? Have we included their family in there? And it keeps coming up a lot, the importance that teach back plays in assessing, did that patient actually understand and can they put into practice what we've just taught them? Include that demonstration. We've demonstrated it to the patient. Now they can demonstrate back to you, and it's going to be a very concrete way of ensuring, are they actually able to do this for themselves? I used to have a patient in dialysis. He was working to get peritoneal dialysis, a form that he could do at home. And unfortunately, we taught it to him. He very knowledgeable, very smart, very with it. And unfortunately, when it came time to getting very close to getting that catheter placed, we discovered that he was not really did not have the finger dexterity to really do that. He was going to try to do it with his mouth. He could really struggle through it when he demonstrated it back to you, but we discovered when you weren't looking, he was doing it with his mouth every time. And unfortunately, infection is going to be a very major, major concern. And it took a lot of practice to where he was comfortable and making sure that he was aware that you cannot be taking those caps off with your mouth. Because that was a real concern for all of us involved. Because as soon as you'd turn around, he'd try to cheat. It was evaluation, evaluation, evaluation. You'll have so much patient education where they will nod along with you, and then it'll come back and they did not comprehend it all. You really want to make sure that the patient has learned what we have set out to teach them. They can, if teach back is not going to be an effective strategy, they can at least explain back to you in simple terms. We have evaluated that they comprehend what we have went to teach them, because once they get back home, they are on their own. We give them their numbers, encourage them to call back with any questions. But right now, while we have this patient in the facility, is the time to make sure they both learned what we went to teach them and also understand and are going to be able to take that home and put it into practice themselves. Also, not to leave out documentation. Again, if it isn't documented, it didn't occur. Make sure you are also documenting that you have taught this patient. And finally, wrapping up with our audience response question. A patient states, I walked regularly for a year to help prevent osteoporosis, but recently I haven't been motivated to continue. Which stage of the trans-theoretical model of health behavior change would the nurse identify from this statement? That be A, action, B, preparation, C, termination, or D, maintenance? We'll have the answer on the next slide. That answer is going to be A, action. We've prepared this patient, we've taught them, and they began exercising on their own. Exercise is going to be a key role in preventing that progression of osteoporosis. Unfortunately, that patient has stopped, and we need to identify why did they stop. Is it pain? Is it weather? What is the barrier or issue that is keeping this patient from putting that intervention into action? And again, that's all I've got for you for this chapter. Feel free to reach out with any questions you have, and I'll see you in the next slides.